So we're going to go ahead and get started for this evening. My name is Susan Barkman. I'm the assistant to the city manager and the staff liaison for the Age Friendly Task Force. And our chair, Sarah Kininger, is not able to be with us this evening. She's recovering from a surgery, so she sends her regards and wishes that she could be here as well. First off, I think I would like to start with thanking everybody who has volunteered their time and effort for this initiative and this program. It really does mean a lot to the city, to our residents, and everybody's taking time out of their own lives and schedule to be here and to volunteer their time. So we really appreciate you offering your advice and your professional experience and your resident experience as well. Our task force members are going to introduce themselves a little bit later this evening, so you'll get to meet all of the different group chairs as well. So we're going to dive right into the ARP Livable Community. So we're working towards a plan that will hopefully give us a livable cities designation from the ARP. You guys are going to be a part of helping to construct our plan. We are entering a time of a lot of change in the community across the United States. Our age demographics are aging, and we're seeing more and more seniors throughout the United States, but especially here in Michigan and in Royal Oak. By 2030, there will be twice as many people over the age of 65 as we had just 3 years ago. Oh, did I skip one? I skipped one. And every day, 10,000 adults turn 65. So every single day, that's a lot of people. And some of them are always right here in our community as well. So we're working towards this idea of becoming a livable city. And I always think that all cities are livable, but it's our quality of life that kind of brings things together. And as our demographics shift, it's important for our community to grow and change with that and understand the changing needs of our community and our residents. Some services over time expand, some contract, some do different things. And so that life cycle of how our community is evolving is really important. And that's what we're working towards building today. A livable community is a space where everyone feels safe, secure, has affordable and appropriate housing and transportation options, and is offered supportive community features and services. And once in place, these resources enhance everyone's independence. Working towards a goal of having a livable community, again, we're all feeling safe. We're able to participate in regular community activities. We're treated with respect. We have access to safe, appropriate, affordable housing and transportation. We have access to recreational opportunities and health services. We know what services and activities are available and what we have access to information and by a means that they prefer. Being an active and vital contributor to the economy, civic, and social life in the community, and receive appropriate support if we can no longer look after ourselves. That's all part of the goal of being a livable community. An age-friendly community is inclusive and has an accessible environment that promotes active aging. It emphasizes enablement rather than disablement. And our impact to Royal Oak is as we age. So this data that you're seeing on the screen is provided through SEMCOG, which is the Southeast Michigan Council of Governments. So it's an organization that helps take our census data and forecast it into the future. And so what you can see on the screen here is that as time moves on, how people age within our community is changing. And so even our overall population goes up, even though our 5 to 17 age population, that number goes up, we're still kind of seeing these different changes in the way that our numbers are working out. So the overall change is actually kind of significant when you look at 2,000, almost 2,500 more seniors between 2015 and 2045. And so some of these numbers are really going to impact how our community functions and what we need from our services and our resources. So a little bit about our project background. So the task force was started in 2018. The City Commission authorized the creation of the task force in recognition that this changing and growing trend of aging in place and needing more senior-friendly services is happening, and our residents need it. In 2019, early in 2019, the City Commission authorized us to formally apply to the ARP's Global Communities Process and Designation and go through the process that we're going through now. In 2019, there was a survey. Some of you guys may have been familiar with that. You may have seen that. Maybe that's where you signed up to be a part of a working group, was back in one of those surveys or back in the focus groups in 2019. Those events, helped us collect data from our residents to understand what they're interested in and how they would like to move forward. We worked on collecting all of that data through the end of 2019. And the goal originally was to move right into the next phase, and then the pandemic happened. And during the pandemic, in the early part, this group was one of many city groups that took what I'm affectionately calling a pandemic pause. They did not meet for about a year while we all kind of adjusted to this pandemic and what's going on with it. Earlier this year in April, the working group, the task force, started meeting again. They reviewed data and started preparing for this next phase of the process. So now we're moving into this working group phase, and that's where all of you are coming in. You guys are going to help us, and you're going to help craft this plan. So in the spring, between January and April-ish, we're hoping that you guys will help create these action plans for your specific domain. Then kind of tentatively through May through October, we're going to be working to draft everybody's pieces together and really round out our plan with some really good information and really solidify some commitment. We're going to have a public comment period process. So this is not the end of public engagement for this plan. After you guys get everything together, we'll work through that and hopefully get City Council approval. And we'll submit the plan to the ARP for approval. Then the next step of this process for the next several years is actually implementing the pieces that you guys are going to be working to think about and evaluate and come up with different solutions. So that's kind of a little bit about our timeline and how we got to be in this part of the process. So the task force worked to create some vision statements for where we're headed. In an age-friendly Royal Oak, people respect, support, and listen to each other. They recognize the value of all generations' contributions to the community that is inclusive, welcoming, vibrant, safe, and livable for all. The mission of the task force is to develop an ARP-approved plan to make Royal Oak age-friendly based on a comprehensive understanding of the community's needs and wants. It will be data-driven, data and expertise-driven, implemented through collaboration, taking strategic advantage of resources and opportunities. And we're going to be working to continue this path of monitoring and our progress and looking and talking to you guys as well as the task force and the community about the progress we're making. One of the things the task force spent some additional time on was creating values and how do we want to kind of come up with this plan. So a big part of that is being community driven, engaging our residents. We're doing that with the data collection process, with the working groups, and with the public comment period as well. Operating with integrity and transparency, strategy, and thinking about how do we best use the data we've collected and to determine our community needs and use our resources efficiently. respect and equity, and remembering that we want to ensure that everybody has an opportunity to participate in this process, contribute, and recognize that everyone has different perspectives. Collaborate, really kind of working to maximize everybody's stakeholder input and expertise, and creatively. We want to engage in an imaginative process for innovative solutions that change our community for the better. So next up, we're going to go through the domains of livability. So in the next part of this, each of the chairs is going to take a moment to introduce their domain. Each of you is serving on a different domain. And so you're going to get a chance to meet all the chairs and learn a little bit about each of the different domains. And we're going to start. This is just kind of an overview. So we have community and health services, housing, communication and information, outdoor spaces and buildings, transportation, and community engagement and inclusion. So those are our 6 domains for our project. We're going to start with outdoor spaces, and I'm going to throw it over to Sue Wells.
I'm trying to get my, I thought I could get my video on. I apologize. Good evening, and thank you for participating in this group. I know when many of you throughout the day, the last thing you want to do is a Zoom call to go over a plan, but we're excited that you've committed yourself to help us out with this exciting plan. My name is Sue Wells. I've been a resident of Royal Oak for 30 years, and I call Royal Oak my home. I am almost, I think I can say 9 more working days retired. I have to work 9 more days as director of Oakland County Parks. So I found it very fitting to take on this task of outdoor spaces and buildings. One exciting part about outdoor spaces and buildings is we talked about going on pause for COVID, but never has parks in Royal Oak, in Oakland County, and at the state been busier. The value of parks to all residents have been increased, have been used more, and it's very exciting to see. So our goal with this project is how can we make the parks more livable and more user-friendly? We have parks that people use in this time, not only for physical activity, but for mental health. You know, people have dogs, their heart rate is lower. Have it be a dog park or walking your dog. So the value of parks is so valuable, and we want to make certain that we capture for this plan how we can make it accessible to the residents of Royal Oak. Another component are buildings. Living in Royal Oak, there are many public buildings that we like to use, but there may be a reason for us not to be able to use them. Have it be distance, parking, traffic, and we would like to address this with our plan also. So the most exciting part about this is you talk about plans, and when plans are done, they're put on a shelf. But this plan is going to be a breathing document that the city council will approve and will forecast how we can implement your recommendations to get this plan completed. So that's my song in a nutshell. I'm excited and looking forward to working with you.
Hi, everyone. My name is Paul Webb. I'm a Royal Oak resident for all 32 of my years. I have the domain of transportation And that's going to cover a wide range of things, not just getting flying cars to everybody, but also how people get around, whether it be public transportation, alternative transportation, walking, car ride sharing, things like that, as well as accessibility to the places people want to go, whether it's their doctor office, the grocery store, bar, restaurant downtown, things like that. So there are a lot of things that intertwine all of the domains we have. And we're looking to try and make it so that everyone can do the things they want to do safely and get there without having to pay an arm and a leg or something for transportation. So.
Thank you.
Yeah.
Richard? Richard, are you there?
Mic on. There we go. I'm Richard Schmidt. I am the facilitator for the housing domain. I'm a relatively new resident of Royal Oak. I moved here originally in 2017. I bought a condo up near 13 Mile and Rochester Road. I'm actually a retiree, so I was moving closer to where my daughter and grandkids live, and to help them with some of their needs, provide transportation when they needed it. But I discovered the condo that I moved into really didn't fit with my needs. It was a 3-story condo. I was going up and down stairs all the time, and that became difficult for me to cope with. So my wife and I decided, all right, we needed to maybe consider moving back to a 1-story residence. We looked around a lot in Royal Oak, and we saw a lot of 1-story residents in the used market that were great, except the laundries were in the basement. We didn't like that. We wanted everything on 1 floor. So we ended up building a ranch here in Royal Oak with a builder that had done that, and we implemented a lot of the things that I think a lot of people, particularly as they changed their situation from raising a family to being in middle age and building their lives and their wealth when they can, to then retiring and wanting to stay in that same community because of family that perhaps lives here, or they just enjoy the community. I actually grew up here in Royal Oak, just less than a half a mile from where I currently live. But when I was asked to join this task force, housing seemed pretty interesting to me, because a lot of the things that the participants in the surveys and the focus groups were talking about, the need to do a lot of things as they age to make themselves able to stay in their houses. So I volunteered to be in charge of the housing domain. And I think that there's a lot of great things that the people that participated had to say about looking for inexpensive handymen that can help with doing some of the chores, the need to adding maybe grab bars because we're not always as stable as we used to be, having wider door openings so that eventually if we need to have a wheelchair or a walker, we can move around in our houses, and having things basically where you can come directly in from the outside to the inside and enjoy life up until the 90s and hundreds. So that's why I chose to look at the housing. We have a lot of different housing opportunities here in Royal Oak for new families, existing families, seniors. So I just felt that this would be a great place for me to maybe add my contributions. And I'm looking very forward. It looks like we have a good work group to work on housing, about half residents and half experts in the field. So I think we can learn from each other and come up with a good work plan to contribute to making Royal Oak age friendly and being able to allow our community to stay here through all the ages of their life. Okay, that's fine.
Thank you.
Hello, everyone. I am Sue McKee, and I am the facilitator for the Community Engagement and Inclusion domain. You'll notice at the bottom of the slide, it indicates that this domain originally was 3 separate domains that the task force made the decision to combine. And that was based on our experience throughout the focus groups because of the amount of overlap that we were seeing in the feedback that we were receiving from residents. So in spite of combining those 3 domains, we still hope to address the needs that originally existed within the 3 groups. I am a 33-year resident of Royal Oak, and in my professional time, I'm a social worker that supports families who have family members with disabilities. We know that loneliness, sadness, and isolation may have a negative impact on health and well-being. This is something that we've all experienced to different degrees over the last couple of years. In fact, research has shown that having meaningful relationships in our lives is the one thing that has the greatest impact on our happiness, health, and well-being. Having opportunities to socialize, having access to accessible
Sue, it sounds like you cut off there.
Am I freezing up or what's happening?
Your audio just cut out.
Oh, okay. Let me know if that happens again. I'm not quite sure why. I'm wondering if my Wi-Fi's popping in and out a little bit. So I'm not sure where you lost me, so I'll start with really what we're working towards, and that's developing opportunities to socialize, have access to accessible, affordable, and interesting activities. We're hoping that people will feel valued and have opportunities to contribute in our efforts to meet this need. Community engagement and inclusion domain will look at possible solutions for these issues while increasing the opportunities for meaningful participation and connection. So I thank each of you for being willing to, as each person has spoken about, to give up your own free time in order to work towards these goals. I think I'm excited about it. I think it's a great opportunity to be creative, and looking forward to see what we come up with.
Thank you.
Hello, everybody. Can you hear me?
Yes.
Great. I am Charlene Douglas. I'm the chair of the Communications and Information Work Group. I'm a city commissioner and was very influential in bringing this whole task force together. I'm also an urban planner, and I've seen through my work in the planning community the silver tsunami, as they call it, of our population as it ages, and the growing percentage of our population that will be over the age of 65. My career has been in public relations. I'm retired from a career mostly in public relations. And so it's kind of a natural thing that I would wind up chairing this committee or this work group. I did a quick survey to the work group members, and thanks for everyone for your quick responses. It does appear that our group will be meeting in person. We, of course, will follow all of the protocols that the city has in place at the time, and we're looking for a location probably at the senior center where we'll be able to space out. Of course, we will wear masks, but I look forward to the opportunity to work in person. I think we've all learned over the past year and a half that Zoom we're happy to have Zoom, but it is a poor substitute for personal communication. And that's what this group is about. I see this group as kind of the glue that holds it all together. We will not only discuss and plan for the communication vehicles that the city needs to communicate with our people, but also will be bearing news of the work of the task force as a whole. Sue McKee spoke of the loneliness that people find in their lives, and communication can help address that as well. There are people in our community who are hard to reach, even those who have a daily newspaper or a weekly newspaper. And I think that's going to be one of the challenges of this group, is helping the city develop the tools and the processes to reach everyone. There's also the challenge that people don't know what they need until they need it. That is, you can hear a message a dozen times about a service that you don't need, but the day that you can't mow your lawn and need to find a resource to help you do that is the day that that information needs to be available and at your fingertips. So I think those sort of two layers of communication are one of the challenges that we will address. At any rate, our work group right now, I expect, is going to have its first meeting on January 5th. So those of you who are part of the communications work group, please mark your calendars, and we'll get back to you shortly with details. Thanks very much, Susan Barkman. Done.
Very welcome. Rebecca?
Sure. Hi, good evening, everybody. And I also want to echo my fellow task force members and thanking you all for taking your time this evening and committing some time in the future to be part of this exciting initiative. I am going to be facilitating the community and health services task force. I'm excited about this. My day job is working at Oakland University as a professor of public health and being involved in different public health related initiatives over the years. So it's definitely up my alley, but I'm glad to merge it with my love for Royal Oak. I've been in Royal Oak for about 10 years now, and I really love the city. I'm sort of mid-career, not approaching retirement as soon as I'd like, but knowing it's out there and thinking about how my husband and I could age in place in our home, stay in this city. And so that was really what propelled me to want to be part of this task force. I'm actually one of the newer members. I just came on board around September, I think. But as the working group for community and health and services, we're going to be really focusing on what are the different supports and things that people need to help them be as healthy as they can be. So part of it is going to be about focusing on how to support people in accessing healthcare services, but it's not only going to be focused on healthcare, it's going to be focused on the different community services that are also available that might help people with things like, maybe support groups for working with different health issues, caregiving needs, other needs that would help that people have to maximize their health. So I'm excited to dig in. My working group is going to be starting on January 5th. I think that it's looking like our first meeting will be virtual, and then we can kind of decide from there. And I reached out to my group members in November. If you didn't hear from me, one of the last screens has my contact information, so you can feel free to drop me an email or check your spam, but I will be reaching out again in the next week or so, and I'm excited to get working on this. Thanks.
Great. Thank you. All right, so we're going to jump kind of into where we're at and what we're working on and where we're headed. So each of the working groups is bringing together resident experts whose expertise lies in living in this community and being a part of it. We're also going to rely on our professional experts, our folks who have professional training, experience, education that relates to a specific domain, and bringing together those two different perspectives and experiences in a way that really is going to work beautifully to review our data that we've collected, learn more about our current services, maybe where some gaps are, or what are the challenges to scaling up or down our services as needed, and finding the opportunities for improvement and potential changes to hopefully positively help people age in place in our community. Each of the working groups is made up of at least of 50% resident experts and about 50% of professional experts. Each of the groups wavers a little bit, but everybody has at least half resident experts. We're going to focus on solutions that are things that the city and the community can control. We all can, I think, as we've utilized different services, there's probably a service out there that we think about, and sometimes that's maybe isn't something that the city can control. If it's a state law that guides something, that's not something that I can change or the city commission can change. But it's worth noting, but maybe not a solution that we can really influence through this plan. We are going to be working towards building a plan. And to give you guys an idea of where we're headed, the city, the task force reviewed a lot of different plans from other cities and kind of looked at different models and how they structured the reports and how things fit together. And as a part of your follow-up, I'm going to send you the plan from Boston. That plan was one that the task force really liked how it was laid out. It fits together well, it flows nicely, it's easy to digest. It's something that you can put down and come back to very easily. It's really written in a way that is very easy to understand for your average resident who maybe doesn't have all this context that you guys are getting or that you're going to learn about. And so we thought those were really, really important things. So the way that kind of plan is broken down is thinking about for each of your domains, what do you want? What do you envision? What is the ideal kind of goal for your domain, and how does that impact the community? Then you're going to talk about what you heard from the data that was collected, what we are doing currently, and what are some things that maybe we could be doing differently in the next 3 to 5 years to really make it just that extra thing that makes it so much easier. One of the really nice things about this plan is you guys don't have to come up with one solution. There might be 5 solutions. There might be 6 or 7 solutions. There's no set number and thing that you have to work towards one solution because all of these things are going to require many different solutions to create a successful, livable community. So kind of your meeting structure. So these are some different checkpoints that we're envisioning for you guys as you guys meet. Each working group has been set up with 6 different meeting dates that are roughly about 3 weeks apart. Your chair for your group is going to be your primary point of contact for those specific working groups. So you might hear from time to time from me, but for a lot of this, you're going to hear from your chair of your own working group, especially as it relates to those meetings. So the first kind of checkpoint we have for you guys in the first meeting is to learn, is to handle some housekeeping things, right? Elect a co-chair, a secretary, all those kinds of things. Establish your ground rules for yourselves. But really, we're going to have a sort of a discussion on the summary of the data that was collected already. Start identifying those external groups. Those external groups that get presentations, those may be things that you guys kind of identify in a few different meetings, and that's okay. But also, what is your specific vision statement? What is that we envision goal of what you guys are kind of thinking about for your domain? The second checkpoint is really kind of diving into some of those data points. We're going to provide you guys both a summary and the long version of the data. So if you guys want to really dig in and read all the different comments, you can. We're also going to have a summary for you that gets pretty detailed for each domain. in that second checkpoint, we're again looking for that list of external group presentations. So the idea is that not everybody can sit on this working group, but we can bring in different presenters from different resources to talk about what they do. So you can learn more, you can ask questions about why does this happen this way, or why is this program limited to this income level. You guys get the opportunity to ask all of those questions during those presentations. In the third checkpoint, we're looking for those we heard statements. So those might be your key takeaways from the data of what you heard as to how, and some things that maybe are kind of starting to stick out to you and influence the direction that you're headed. The fourth checkpoint is really about getting through those external group presentations. Those external presentations may happen in a variety of different formats. Depending on how long your list is, we may have some that record a pre-recorded session for you to watch on your own time, and then they come in for your meeting and have more of a live Q&A kind of session. We may have some presenters that more than one working group wants to hear from. And so maybe we try to combine those presentations at another time for you guys to hear from those specific presenters where a couple of you guys want to hear from them. We'll also make information about different presenters available, because I would imagine you all have a reason for wanting to participate in this. And I know I'm hoping to learn a lot about senior services and how that might apply for my parents as well. So I imagine some of you guys are in that same boat. And so there might be a presentation that you want to attend. So make sure that all of those kind of gets out to all the different members so you can kind of see what those look like. Your fifth checkpoint is going to be continuing to really hone in on those action goals. Where is it that you are kind of getting to the we will do this kind of part of this? So really starting to think about those. And your last point is going to be really kind of thinking about each of those goals. What are those short-term goals? What are those things we can do in a year? What are some of the things maybe that are a medium goal for 1 to 3 years? What are some more longer-term goals that would all kind of contribute to those we will do this parts of your part of the plan? So some expectations that as a task force we kind of wanted to lay out. One is to be open to other perspectives. We all come from different walks of life. We all have different experiences and educational backgrounds and expertise areas and trainings that we've done. And together, by listening to all of these different perspectives, we can come up with something that's really, really cool, impactful for our community. And that's what's important. We want to encourage everyone to respect the experience and expertise of other people, to engage in this process, and to do your homework and please come to meetings prepared for the discussion that you're going to have. As a part of kind of building out some expectations, you guys will get the opportunity in your work groups to really kind of go into some ground rules and to kind of have that conversation as well. We do expect that the working groups are going to help draft their part of the plan. And so we'll give you guys some templates and things to kind of help you formulate that part. As an expectation that you can have of the task force and of me as a staff liaison is that we're going to continue to communicate around what's going on. So whether that's throughout the process and the time that the working groups are meeting, or as this process continues to move forward into the finalization of the plan, the public comment period, the city commission approval process, we're going to let you guys know as all of those steps happen. We're also probably going to stay in touch with you after that, because there's this whole implementation phase that goes on after that. And you guys are dedicating a lot of time to creating this. And we want to make sure that we're continuing to provide information and check-in points with you all as well as things get implemented, because that's always, I think, the funnest part of doing things like this is being able to see the things that you thought about and maybe that you had that idea and to see it really come to life and bring joy to the community and into our neighbors is always the best part in my mind. So just real quick though, different working groups again. We have community and health support services, housing, communication and information. These three groups are kind of meeting on the same dates. Some may be virtual, some may be in person, some may be here in City Hall or down in the senior center. We're still kind of working out those logistics of where you guys want to meet, but please make sure you're looking for emails to come from these different email addresses. Your second three groups, transportation, outdoor spaces, and buildings and community engagement and inclusion, you guys are going to meet on some other dates, and you are going to have that same kind of opportunity in those groups as well. One of the things that I kind of wanted to say is you may come across, and I think as you guys are going through this, all of a sudden things about aging friendly and aging in place will start popping out into you in your lives. And so you may see a great thing or a great service or a great idea of something that another community is doing, but it's not in your domain. Please feel free to share that with me. Feel free to share it with the chair of that domain and communicate around that. Just because it's not in your domain doesn't mean it's not something that is worth talking about and discussing and kind of finding those communication and inroads. So we wanted to share just a couple of resources with you guys. And joining us tonight is Karen. And Karen, I apologize because I don't know how to say her last name, from the AARP. So I'm going to give Karen an opportunity to come on in and chat.
All right. Can you hear me?
Yes.
Yes. Well, everybody, hello. I'm Karen Capenteris, and it's pronounced just like it's spelled. And I'm the Associate State Director for AARP here in Michigan, and I lead the age-friendly work. I had the pleasure of meeting Shar Douglas, geez, I don't know how many years ago now, when she first called me about the possibility of Royal Oak being involved in this program. And so I want to thank all of you for committing to be on these domain work groups and putting in the time and the effort. It is, I think you'll find a labor of love, because you'll see what the comments were that came in during the community conversations. And you know, really during those community conversations, I'm guessing most of you were probably involved in those at some point. A lot of those are, you know, people are really speaking from the heart about what it is they need and want to be able to stay in Royal Oak and live an independent life for as long as safely possible. So I thank you for being on that. I was going to, and I still will, offer, you know, to all the domain chairs, I'm happy to try to attend some of your meetings. It looks like a bunch of you are meeting on the same dates. So we'll have to sort of, you know, to be in three places at one time, but I'm happy to, you know, come to some of your meetings. Probably right now we have a restriction. We cannot do anything in person, so I would have to be virtual. I would have to be joining virtually, but I can be there for you to ask questions, and please tell the chairs, feel free to reach out to me at any time with any questions, or reach out to Susan, and Susan can ask me, or however you want to work that out. So there are a lot of resources available about the age-friendly program, the process, and if you go there on the screen, you see the AARP Livable Communities website, and on that, if you go to that website, across the top of that page, you'll see so AARP Livable Communities, the term Livable Communities for AARP is sort of an umbrella. It incorporates a lot of different things that make up our livable communities work, and the age-friendly communities program is one of those. You'll also see information on the Community Challenge Grant, on the Livability Index. There's a whole resources tab. So there's a lot of information. If you click on the age-friendly tab there, you're going to have, between that and the Livable Communities tab, you are going to have more information than you can probably take in. But the age-friendly will help you if you have questions about what am I doing with this? How should I proceed? That probably is your first stop, because there's a lot of really great information on there. There are short videos. There is a lot of things to read, a lot of examples from other communities, just a whole lot of information. So, and I'm here to answer any questions that any of you might have right now. So feel free to ask me any questions, I guess in the chat is how we're doing those, right? Okay.
Yep. In a little bit, when we get to the end, we'll go through the chat and start answering some questions. So again, if you do have questions for any of us, feel free to go ahead and start sticking them in there, and we'll jump to those at the end. Okay. So another great resource that we have locally is our Area Agency on Aging. We're a part of 1B. And they're a really great organization that does a lot of different things to help folks age-friendly and folks with disabilities, and also caregivers. So definitely, as you're if you haven't interacted with their organization before, please start kind of thinking about them as a resource. Look at the website, spend some time to kind of get to know their information a little bit as well. We also have the Royal Oak Senior Center, which is our very local organization and part of the city that helps provide programming. And I know Erin Cook, who's on the call tonight, I won't put her on the spot, but she is here to answer questions about the Senior Center as well, and some of the different things they do. They help operate Roses. They have a senior resource guide. So all of those things are offered through the city, and opportunities for things that we can do to continue to grow. So real quick, before we jump into questions, some things that you can expect in the next few days. So from me tomorrow, hopefully you guys will get an email with all of the PowerPoint and links for all the different things, the presentation, the website where all the age-friendly stuff exists out there. We'll have links to all 3 of these different resources, as well as a couple others. And we're just going to provide you with a ton of information to get you started, as well as the data summaries. And with your individual groups, you guys will that's where we're going to send out some of the in-depth stuff, but at least to kind of get you guys going as you kind of think about your next meeting in January. So look for that email from me tomorrow. After that, a lot of your communication is going to come from your group chairs, and that's kind of a near term what you guys can expect. We are going to sit a little quiet over the holidays, but then right in January, we'll start getting you guys into your working groups. I've had a few folks ask questions about, are we still taking volunteers for this group? We have really kind of maxed out on the number of people that we can reasonably put in these working groups. But we know that life happens, and your best intentions to participate, things can happen, people can get sick, all different kinds of things can happen. So if you know someone who's interested in being a backup, so that if somebody does have to drop out, we can kind of jump somebody else right into that space and help catch them up, that would be great. We're taking names for that at that part of it. So if you do know someone who's interested in still participating, please have them reach out to me directly, and you guys all have my email address. So we've got a few questions, I think, coming into the chat. The different working groups. So I have, we'll provide a list for everybody who's in each of the different working groups. We have about 51 people, I think, and not everybody is able to join us this evening, but we'll provide a list of who is in all the different working groups, and a little bit about either they're the resident expert or a professional expert. Kate Wendell, I see you joined us. She is from our area agency on aging. I'm sorry, Kate, I didn't see you in there. I didn't make that connection. If I can unmute you here, do you want to say a couple words and I'll put you on the spot? I see you. Kate?
Yes, hi, can you hear me?
I can. Do you mind? Do you want to say just a couple words?
Yeah, no problem. My name is Katie Wendell. I am the Director of Planning and Advocacy at the Area Agency on Aging 1B. So as described, we serve a 6-county area, including Oakland County. We receive federal and state funds for senior services and distribute those in the community, as well as providing some services directly. So I'm a Royal Oak resident myself. Have lived here for just over 6 years. So excited to be involved both as a resident and to share some of what we do at the Area Agency on Aging. So I'm sure in lots of the domains, there will be questions for the agency, and some of those I can answer myself, and some of them I might tap some of my colleagues to provide stronger expertise on a certain issue. But happy to be connected with you all as we get to work.
Great, thank you. So the other questions I'm seeing in here are about which group you're in. And it looks like, thank you to my task force members who answered those questions for folks as we went through. If you're not sure which group you're in, please just send me an email and we'll get you all squared away. We had a lot of folks who said, I'm interested in a few different working groups. And we really tried to only have folks participate in one working group so that way we could include more people in this process and allow more voices into the different rooms. So again, that's why we want you guys to share information between working groups. If you find a great resource that belongs with another group, feel free to send that over to them. You're also welcome to attend different working groups if you're really interested. That's something that you absolutely can do. And there may be crossover points or maybe kind of connection points. I think as the task force has discussed as we've gone through this, there's a lot of things where it's like, is that information and communication, or is that the service, or is it a little bit of both? And so we may have different things that come up that do fit within two different groups. So we'll be working through those as we go. I'm not seeing any other questions in the chat or in the Q&A. So again, I want to thank everybody for coming tonight. This again is going to be posted on the website, and everybody can have the opportunity to watch it again as well. Thank you again for spending your time with us this evening and for volunteering again. It really does mean a lot, and it is something I'm excited to see you all and get to know you guys and continue to work. If you have any questions at any time, please feel free to reach out to me, your chair, or another task force member. Okay? With that, I think we'll call it a good night.